Hello, my name is Gabriela Chuquisala Canales. My topic about a phase 3 trial of Sebelipase Alfa in Lysosomal acid lipase deficiency. Definitions. Lysosomal acid lipase is an essential lipid metabolism enzyme that breaks down endocytosed lipid particles and regulates lipid metabolism.
My name is Mark Goldberg. I'm Executive Vice President for Medical and Regulatory Strategy at Synergy Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there's a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particularly in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually a microvesicular steatosis, that progresses to fibrosis and cirrhosis. And leads often to liver failure even in childhood. There's also a dyslipidemia marked by a high LDL and a low HDL and a variably elevated triglycerides that leads to accelerated atherosclerosis. First of all, extensive preclinical data and a very relevant animal model that showed by giving a recombinant human enzyme to replace the deficient lysosomal acid lipase, we could get the enzyme to bind to mannose and mannose 6-phosphate receptors on cells, get internalized, traffic to the lysosome, and replace the missing enzyme. We showed that we could reverse the fatty accumulations in the liver in this animal model. We could improve growth in the animals and improve survival. We've now moved into a phase 1-2 clinical trial that is described in this poster. In that study, we studied 8 adults over 90 weeks being treated with the enzyme, and we showed that with every other week treatment, we could see a dramatic decrease in the previously elevated transaminases. They started elevated, they came down into the normal range, and they remained in the normal range during this 90-week period. Similarly, with replacing the missing enzyme, we see a mobilization of the accumulated lipids. So once the triglycerides and the cholesterol esters are hydrolyzed, we initially see the mobilization as evidenced by a transient rise in cholesterol and triglycerides, but with continued treatment, these decrease to below baseline levels, and by 90 weeks, we see about a 50% reduction in LDL cholesterol compared to the original baseline, a similar decrease in triglycerides, and a modest rise in HDL as well. The study is now ongoing, and we have a phase 3 trial in children and adults that's now fully enrolled and is maturing at this time. We hope to have data from that trial in the latter part of this year.
Application in nursing. In this multi-center, randomized, double-blind, placebo-controlled study involving 66 patients, we evaluated the safety and effectiveness of enzyme replacement therapy with Sebelipase Alfa administered intravenously at a dose of 1 milligram per kilogram of body weight every other week.
two presentations on a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind, placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2-3 study in infants with the most rapidly progressive form of the disease, which is typically lethal in the first 6 months of life. And then we have a poster which describes 2-year follow-up data on adults that were put into the first human study with Kanuma, and that's taken through to 2 years of treatment.
Pros and cons. The alanine aminotransferase level was normal in 11 of 36 patients, 61% in the Sebelipase Alfa group, and in 2 of 30, 7% in the placebo group. We observed improvements in lipid levels and reduction in hepatic fat content for all comparisons, except for triglycerides. The number of patients with adverse events was similar in the 2 groups. Most events were mild.
For those of us that do adult medicine, lysosomal acid lipase deficiency is still an important thing. Granted, it is primarily a pediatric disorder, but we're finding more and more adults who have this disease. And why we didn't pick it up as children, I don't know. But we cannot count on the pediatrician to pick it up in childhood. There are times when the manifestations are just not that dramatic. And so when we see adult patients, and pretty much throughout the age spectrum, I suppose if they're over 85, we don't need to worry about it. But pretty much not only the young adults, but the middle-aged and even up into older individuals, let's keep in the back of the mind LAL deficiency. Now, when do we look for it? It's a rare disease. We've got to have something that tells us to think possibility of LAL deficiency. The first and foremost is high cholesterol. And there is this nationwide push to focus on familial hypercholesterolemia. We're doing screening in our adults. We're looking at our adults. We're saying, wait a minute, do you have a really high cholesterol? This is an exciting time in clinical lipidology because we're getting new tools, new drugs all the time, and more coming down the horizon that are going to help us treat elevated LDL. So there's a focus on this. That's fabulous. But remember that everything that looks like standard heterozygous or even homozygous FH is not necessarily that. It could be this rare disorder, LL deficiency, masquerading as FH. So we see the high LDL. We're going to see a low HDL. Pretty much without exception, that HDL is going to be below the usual cutoff that we would ordinarily see. The third piece is there's something going on in the liver. And the easiest way to pick this up in adults is with elevated transaminases. Now, there are many reasons. You've got viral disease, you've got alcohol use, whatever. But realize that if somebody has an elevated transaminase, we need to think about it, and especially if it's otherwise unexplained, because that is not a part of FH. And so high LDL, low HDL, and then the high transaminases, we need to think this might be LAL deficiency. We've got 2 choices. We can refer to our friendly neighborhood clinical lipidologist, who should be versed in this and should know exactly how to do the screening, or we can do it ourselves. And the screening is actually very simple. What we do is we get a dried blood spot on a special card, and then we send it off to a laboratory, and there's some laboratories that are specializing in this, and some of these laboratories will do it for free. If we get the right kit from the right people, then we can do the screening in our own office, or if that's a little too cumbersome, fine, we refer for the screening process to our clinical lipidologist. So we either refer for the screening or we do the screen. If they screen positive and there's 0 overlap, you've got the normal range and you've got the abnormal range, there is no overlap whatsoever. So this enzymatic assay is completely definitive, completely diagnostic, and it's free to the patient and free to us. So I think we've got an ideal situation if we can just remember that in this haystack of familial hypercholesterolemia, every now and again we're going to run into a needle and that needle is going to be LAL deficiency. Now, the way we find the needle is it's sticking up at us because it's not only the high cholesterol, it's the low HDL, and it's the high transaminases. And if we've got that index of suspicion, we will screen or we'll refer for screening. If we find somebody with LALD, then we will refer to somebody who specializes in that. And that would be primarily the clinical lipidologist, but of course, the hepatologist could probably help us there too.
Issue applied in Ecuador. The placebo-controlled phase of the study was 20 weeks long and was followed by open-label treatment for all patients. The primary endpoint was normalization of the alanine aminotransferase level.
This is a disease that we've probably misdiagnosed or underdiagnosed for many years, and it goes under the radar. Patients who have significant liver disease, fibrosis, and cirrhosis may be misdiagnosed as cryptogenic cirrhosis. A large number of patients may be labeled as fatty liver disease patients, and unless we can screen these patients and pick up this disease, we're not going to be able to offer them the treatment that will soon become available to this population. A very simple test for this disease is measurement of enzyme activity in dried blood spots. So it's a simple finger stick with a little bit of blood that goes on a piece of paper, and this test can be sent out to commercial labs. For example, LabCorp or Mayo both can test for this disease and give us a diagnosis of LALD.
In conclusion, Sebelipase alpha therapy resulted in a reduction in multiple disease-related hepatitis and lipid abnormalities in children and adults with lysosomal acid lipase deficiency.
The most difficult part of that year was just not knowing. The stress of test after test and just not knowing what was wrong with him. We did a liver biopsy, and that's when we found out he had stage 2 scarring on his liver already at 5 years old. The day we found out Tristan had this, it was a whirlwind of emotions. I was devastated. My little guy has a problem. What can I do to help Tristan? It was just, if I could change places with him, I would do it in a heartbeat so he wouldn't have to go through it. To find out that there was a trial to help him, it made everything better. It just kind of helped us cope with it. We just told the doctor we just want to do it. Whatever we can do to help him get better, we want to be a part of it. Since Tristan's been in the clinical trial, his lab results are great. Life like today with Tristan is like any other day. He's a normal 8-9-year-old kid who just wants to run and play, and he really doesn't let it hold him back. He just goes and plays, and he lets everybody know what's wrong so they know to take it easy on certain things. But other than that, he's doesn't let it affect his life. For Tristan, the future, I hope he continues on with help raising awareness and helping other people with the disease and just being an advocate for them and just telling his story so they know that it will get better. I foresee Tristan being the same type of kid and just growing up and hopefully being able to have a normal, regular life and just not letting this push him down and just not be able to achieve what he wants to do in life and just be able to do good.
Thank you.